South Florida, and I'm here to do your head-to-toe assessment. Can you tell me your name?
Casey,
And how old are you, Casey?
15.
15. You seem very appropriate for your age. Your dress is very appropriate for the weather. It's pretty hot outside.
It is.
Yes. So the first thing I'm going to do is wash my hands with some hand sanitizer. Okay. I'm going to put on some gloves. So do you have any wounds or any lesions in your head at all? Any
No.
sores noted anywhere? Okay. So I'm going to feel around in your scalp. It's not tender.
Nope.
Okay. All right. I'm going to look at your fingers. Capillary refill is less than 2 seconds. That's good. Your skin is warm to touch. Your turgor is good. Your skin is very smooth. I wish I had your skin. All right, so we're gonna discard this. Okay, so next I'm going to look inside your mucosa. Okay, can you say ah for me? I'm gonna wash my hands one more time. Say ah. Okay, can you stick out your tongue? Perfect. And I'm gonna precipitate the gag reflex. Say big gag. Good. That's cranial nerve 10 for the vagus. Hypoglossal is cranial nerve 12, and also cranial nerve 9 for the glossopharyngeal. Okay. So next, I'm going to look at your face, make sure it's symmetric. Your eyes are symmetric. Your eyelashes are present bilaterally. They're symmetric. Can you smile for me? Smile big. Can you frown for me? Can you close your eyes? Open your eyes. Okay. So that was cranial nerve 7. Okay. So next, I'm going to touch your face with a cotton swab. Just tell me whenever you feel the cotton swab. Okay?
Okay. Feel it there.
Okay. Say now when you feel it. Okay?
Now.
Okay.
Now.
Okay.
Now.
All right, so that was cranial nerve 5. You have sensory. Okie dokie. So next I'm going to look at your sclera. Her sclera is white, and her conjunctiva is no drainage, no redness, which is great. Are you having trouble with your eyes?
No.
Okay. So next I'm going to check her pupils. Her pupils are equal and reactive to light accommodation. So now we're going to do a confrontation test. That means that I'm going to cover one eye, and you're going to tell me what you see in your periphery. Do you see 1 finger, 2 finger, 3 fingers? Okay? So cover. Great job. So tell me how many fingers?
1.
Perfect. You could do your other eye. Cover your other eye for me. Perfect.
1.
Perfect. So lastly, for your eyes, we're going to also look at this board over here. If you could turn for me.
Okay.
So can you tell me the first 3 letters?
E, F, P, T, O, Z.
Okay, so her vision is 20/20. Perfect. Have a seat. So next, I'm going to have you follow my fingers. And I just want you to, don't move your head, just follow with your eyes, okay? Okay, great. That was cranial nerve 3, 6, and 4. Yeah, 3, 4, and 6. All right, next I'm going to look in your nose for patency. Perfect. Her nares are symmetric and patent. And next I'm going to palpate your ears for any tenderness. You have any tenderness? Perfect. Okay. So next I'm going to feel your lymph nodes to make sure you don't have any So next we're going to palpate your lymph nodes to check for any tenderness, any swelling. Okay?
Okay.
All right. So pre-auricular, come closer, cameraman. Pre-auricular post-auricular. I'm going to come behind you. Occipital. Submandibular and supraclavicular. Okay, so no tenderness?
No.
No tenderness noted with the lymph nodes. Okay. So next we're going to, can you open up for me? Say, open up. I'm going to feel for any TMJ. You can close. Okay. No TMJ noted. So next I'm going to look at her trachea. Her trachea is midline and symmetric. I'm going to feel her carotid pulse. Her carotid pulse is noted bilaterally, and I'm going to listen for any bruits or thrills. Next, I'm going to listen with the bell as well. Sorry, Casey.
It's okay.
No bruits or thrills noted. So next, one more time, can you open up for me? Say ah. Okay. So her oral mucosa is pink, it's moist, and her tongue is smooth. No lesions noted there. Okay, so next we're gonna listen to her respirations. First, I'm gonna listen posteriorly. So first, we're gonna listen up to the right upper lobe. Left upper lobe. Right middle lobe. And the costovertebral angle. Her respirations are symmetric. She's not having any retraction. She's not using any accessory muscles. Also, her respirations are about 17 respirations per minute. Okay, so next I'm going to inspect your chest wall and listen for cardiovascular sounds. So we're going to use the diaphragm first. S1 and S2 are noted, no murmurs. And her apical pulse. I'm going to take her apical pulse. So her apical pulse is about 68. Next, I'm going to feel for her pulses. So first pulse is the radial pulse. Brachial pulse. There are 2+, bilaterally. Popliteal pulse is behind the knee. And lastly, her pedal pulses. Okie dokie. So next we're going to do your abdomen. If you can lay back for me on the table. I'm going to listen to all 4 quadrants of her abdomen. Bowel signs are hyperactive. And present in all 4 quadrants. Next, I'm going to palpate for any tenderness. Does it hurt when I do that, Casey?
No.
Okay. All right, so next I'm going to deep palpate. Does it hurt when I do that? Any tenderness? No swelling noted.
No.
Okay, Casey, you can sit up for me. Thank you. So next we're going to do your musculoskeletal. Can you put your arms up for me? Can you push down, a resistance? Good. Can you put your arms up for me? Can you try to push down? Good job. Okay. So can you put your elbows out for me? Perfect. Can you turn in and out? Great. Okay. And your wrists? Can you flex your wrists? Okay. So next I'm going to ask for your legs. Can you flex for me? Try to push against me, okay? Great. Okay, great. Her muscle strength is strong and equal bilaterally. Also, can you shrug your shoulders for me? Good job. That's cranial nerve 11. All right. So I'm going to say 3 words, and at the end of our assessment, I just want you to repeat them to me, okay?
Okay.
The 3 words are board, cat, and shorts, okay?
Okay.
All right. So can you stand up for me? All right. So just put your finger to my finger, and then your finger to your nose. Finger to my finger, finger to your nose. Finger to my finger, finger to my nose. Great coordination. So can you just walk straight for me? And walk back. Okay. Can you just stand on one foot like this? One more time. Finger to my finger, finger to your nose, finger. Last one. Okay. Can you repeat those 3 words I gave you at the beginning?
Board, cat, shorts.
Great. Excellent memory. Thank you so much, Casey, for helping me with my physical assessment.
You're so welcome.
Thank you. The end.